Welcome guys to another series on the bones of the upper limb. The bones of the upper limb. See, I've broken down all the bones starting from the clavicle, the scapula, the humerus, the ulna, the radius. So now we are in the carpal bones in the hand. Told you that the radius articulates with the carpal bone to form the radiocarpal joint, or we call it the wrist joint. But the ulna do not participate in this formation. So look at this bone very well as I'm talking one by one. Follow it, you understand very well. Now the carpal bones, now they are 8 in numbers, arranged in proximal and distal row. Again, the carpal bones are 8 in numbers, arranged in proximal and distal row. In the proximal row, remember the mnemonic, she looks too pretty. She looks too pretty. What is she looks too pretty? Scaphoid, lunate, Triquetrum, and Pisiform. Scaphoid, lunate, Triquetrum, and Pisiform. Now in the distal row, you have the trapezium, trapezoid, capitate, and hamate. Try to catch her. She looks too pretty, proximal row. Try to catch her, distal row. You get it now? So you try to catch her trapezium, trapezoid, capitate, and hamate. Now the individual bones, their name is according to how they are. You get it now? So the individual bones are oriented. So the one that is articulating with the radius bone is she looks too pretty, which is the what? Scaphoid, lunate, and Triquetrum. The one that is articulating with the metacarpal is the trapezium, trapezoid, capitate, and hamate. So this try to catch her is articulating with the metacarpal, while the she looks too pretty is articulating with the radius bone. Hope you understand it. Very easy. Now all of them have different shape, just that's how their name is. So the person that brought them out, or the person that discovered them, looked at their shape and gave them that name. Now we are talking about scaphoid. It's boat. You can see it's just like a boat like shape, which means it has an indentation inside, so it has a boat like shape, and you get it, and it has a constriction called the neck. So scaphoid boat, don't forget scaphoid boat, because it's very important landmarks, because it forms the floor of the what anatomical snub box, the scaphoid. So anytime there is damage to the anatomical snub box, it can cause what scaphoid fracture. So scaphoid is the only bone that can get fractured easily. Don't forget, scaphoid is the only bone that can get fractured easily. Lunate, when you say lunate, just like the moon shape, lunate, luna. So it is the only bone that can dislocate easily. Scaphoid can fracture easily, lunate can dislocate easily. Triquetrum, it is pyramidal in shape. Triquetrum is pyramidal in shape. Pisiform is sesamoid, it's very small. I get it now. Last bone to ossify. Last bone. So we'll talk about it later. Last bone to what? Ossify. Trapezium, now try to catch her. Trapezium, just like the trapezium shape you see in your normal physics and mathematics. The trapezium is what quadrilateral in shape. It is what quadrilateral in shape. Trapezoid, it looks like a shoe shape. So you are seeing it on your skin, shoe shape. The largest bone of the carpal bone, or you can call it the largest carpal bone, is called the capitate. Capitate is the largest carpal bone, and the first bone to ossify. It is the largest carpal bone and first bone to ossify. The one that fractures easily is scaphoid. The one that dislocates easily is lunate. You get it now? The last bone to ossify is the pisiform. Don't forget it. Get it now? Why the hamate is like a wedge shape. Hamate is like a wedge shape. So you call it the hook because it has a process which is hook-like. So you call it the hook of the what? Hamate. Hook of the what? Hamate. So what is the ossification? We call it is ossified by endochondral ossification. So the first bone to ossify is the capitate in the second month. It's the capitate and is the largest bone, while the last to ossify is the what? Pisiform. All of them by endochondral ossification. First bone capitate second month, followed by hamate end of third month, followed by triquetrum third year. Second month capitate, end of third month hamate, third year triquetrum. The last bone to ossify is pisiform, 12th year in male, 9 to 10 years in female. You get it now? Why the scaphoid lunate, trapezium and what trapezoid all ossifies in the fourth year in female and fifth year in male. So I hope it all made sense to you and you understand all what I've said. She looks too pretty, try to catch her. I've talked about all the bones. She looks too pretty. Is scaphoid, lunate, triquetrum, pisiform. While the distal role is try to catch her. Trapezium, trapezoid, capitate, and hamate. We talked about their shape, both moon pyramidal. It made sense. First bone to ossify, capitate, which is also the largest bone. The most fractured is scaphoid. The most dislocated is lunate. Don't forget. The smallest one is also pisiform, which is the last bone to ossify. It's very small, just 6 small. So hope you understand it. So if you are just joining me, make sure to subscribe and share to everybody. Very, very important to share to all medical students that need this video. And if you are just entering your preclinical year, make sure to watch this video, write it down, look at the bones, follow me as I'm saying it, because you understand very, very well. So I'll be seeing my next video on metacarpal and phalanges. Bye bye.